Well, welcome and thanks for tuning in to the score analysis of the progress test. So, what does score analysis mean and what are we doing here anyway? And that's precisely what we're going to be looking at. In our aims for today's tutorial or video, whatever, we're going to be looking at what is a score analysis, what is the score analysis tool, how do I use it, and how do I reflect on what I have found. So let's crack on. So what is a score analysis? Well, score analysis stands for strengths, challenges, opportunities, responses, and evaluation of those responses. Now, people might remember the SWOT analysis, the good old SWOT analysis, which was strengths, challenges, opportunities, threats, and then evaluation and responses to their evaluation. Don't ask me why they had the ER at the end of it, not included in it. But anyway, score is better because challenges and threats are pretty much the same thing. So it's all sort of included in that acronym. So let's move on to when were you going to be doing these score analyses? Well, in Manchester, you'll be doing these score analyses for your progress tests and the clinical competency assessment, or the CCAs, your otherwise known as OSCEs. So this is a thing that you'll have to do, and we're going to look at progress test. And so strengths are things you're doing well, challenges are things which need a bit of extra work, opportunities is what comes up and how you're going to make the most of these things and hopefully maintain your strengths and meet those challenges. Responses are about how you're going to do that using those opportunities. And evaluation is a way of just feeding back when it's actually, it's time to, which would be just before your PPD summary, to actually say what it is that you learned from doing those responses. Were they effective? So let's now have a look at, say, for example, a progress test summary. So let's have a look at what you might see as your progress test results. Well, first off, you'll have some feedback on your progress test, which hopefully will be an honours like this one, which will show that the score that you've got and relate it to the cohort mean, which is very important to understand sort of where you are up to compared to the rest of your year. And then you'll get the kind of an idea of for your cohort, and so year threes will have different numbers from year fours, and year twos and ones, etc. And so you'll be able to see where your score is compared to that. And then the second thing you'll get after that is you'll get below it actually, you'll get the list of what you scored, which relates to, in the columns, the different areas, the different clinical areas like cardiorespiratory, gastrointestinal, endocrine, and so forth. And then you'll get it divided into the medical sciences, then the investigations, diagnosis, and then the management and therapeutics of it. And so your job then is to kind of work out what to do with all of this. So let's have a look at some made up results. When you put them into the score analysis tool and you cut and paste them in, then you'll be able to have a look at the different years. So for example, year 3 you'll see areas in yellow, and that's cardiorespiratory, endocrine, metabolic, hematology, GIT, oncology, breast and infection. There's some of that in year 4 as well, renal and urology. And you'll be able to see within those groups how you compare to the cohort average. So here's 5.5% below, 19% below, 27% above. And then you can look at the year 4 with one semester being F&C, and then the other semester being M&M, and you can do the same thing and assess where you are related to the cohort average. And then you can look across the lines to have a look at the general areas of medical sciences, investigation, diagnosis, management, therapeutics. And then it's about looking at the individual areas, because you'll find that, for example, we know here that this person has a challenge with their management and therapeutics, but it's in year 3 stuff as well as year 4 stuff. You see, so this is definitely a challenge across the board with management therapeutics. And looking at, if you were a year 4 student, you'd be certainly thinking, well, I need to pay extra attention before next time to my year 3 stuff, be it with the responses of the past medicine or with using TCD. So this way you can concentrate on year 3, let's do semesters of year 4. Because don't forget, if you're in year 4 and you're doing the first progress test, you'll have done one of those 2 semesters. And that means you'd expect your scores to be higher for the semester you've done than the cohort average, and you'd expect them to be lower than the cohort average in the semester you haven't done. And that's always worth bearing in mind, because if you're doing, for example, this individual and they're looking at their their M&M stuff, and they haven't done an M&M yet, then they know they've got a strength in neurosciences and senses because they haven't really done it, which is part of year 4. Yet they've scored well. So that's kind of the basis of looking and analysing your score analysis to work out how you're going to respond to it. Now, copying your results is as simple as going on to your OneMed and then highlighting the different areas, starting with medical sciences and highlighting right down to the last number, which is a cohort average for reproductive health, and copying that. Now, it's important that you do all of it because it unfortunately doesn't allow you to just copy individual rows. You have to, individual columns. You have to copy the actual whole, all 4 of the rows. And then what you do is you highlight again in the tool those areas that you need to copy paste into, and then make sure you paste into the match destination rather than the other one. Otherwise it'll go all white and look weird. Now the last thing to do is to make sure you change the not applicables to zeros so that the numbers can work out properly for you. It won't assess it, and then you get that funny hashtag value exclamation mark. So change the NAs, the not applicables, to zeros, and then that'll all work out. Now, we went through this just a little bit ago, which was just to be mindful of what those numbers mean, and to be looking at those columns at the end and at the bottom, to looking at where you fare compared to your cohort average. Because although you're not facing off against your peers, it is worth knowing where you are or how you're doing in comparison to your whole year group as a whole. So this is the importance, and to be checking the different areas so that you can come up with your score analysis. Now, this is just an example of some of the things or the headings you'd be thinking of having, and I haven't filled in the information. And that is to be looking at, well, firstly, having a name for your score analysis so it's clear. And then secondly, looking at your strength, what went well. And in the results we just looked at, the year 3 renal and neurology went very well. So did the year 4 neuroscience and sensors. And just discussing what area of that, why that might be, and did you do any extra kind of work in that area? Just explaining to yourself more than anybody exactly why that's a strength, and noting that it is a strength. Now, the challenges are the areas that you haven't done so well at. So here, year 3 endocrine metabolic hematology, that did not go so well in this progress test. Year 4 mental health, and in general, management and therapeutics. So it's about commenting on those and saying sort of why. I mean, did you not have a placement in year 3 in endocrine? Did you miss some of the TCDs because of illness? Because of a lot of students have missed some of these TCDs because of COVID, for example. Are these make these challenges? They're not again to help you with as far as excuses for not doing well, but just to know, just to sort of reassess and think about why they're challenges, but to acknowledge that they are challenges nonetheless. And then in your opportunities, you want to be looking at which placements you've got coming up to sort of make the most of those placements. And that's especially so when you're looking at the clinical competency assessments. But within the progress test itself, obviously past medicine, those questions, TCD, peer support, is the main areas of opportunities for improving your progress test. And then your responses about how you're going to use those opportunities to meet those challenges and improve those areas whilst maintaining those areas of strength. So that's what's in your responses about how are you going to do it. So those tend to be SMART goals about, I'm going to do 150 past medicine questions properly, that is, as in I'm going to look through the answers properly, and if I don't understand it, I'm going to read it. If I'm scoring poorly, I'm going to go through the TCD, that kind of thing. And then the evaluation is something you're going to do a bit later on, a couple of weeks for your progress tests, your portfolio, for example, to update. Well, you've been doing the responses for a certain amount of time now. Have things improved? Have your past medicine test scores gone up? Have you been through all the TCDs? Have you spoken to any friends, especially ones who've managed to do well in the progress test? And have you found the placement teaching helpful on the or being on placements helpful for the PT? That kind of thing. So hopefully all of that's made sense. In summary, the score analysis is very useful. It's a very useful tool. It's a very useful way of reflecting on how a progress test has gone. It's also useful to analyze what do you need to do better in your progress test next time. You know the average cohort average is going to be going up next time, and you need to meet that challenge. And the tool is just one way of trying to help you understand the different areas and different ways of looking at it. Now, please put some comments below, as I'd love to know what you think about it. And well, I hope the next progress test goes even better than the last one.